Good afternoon, everyone. I'm Dr. Ruby Sharif-Sandel, and I'm the OUHSC Campus Faculty Activity System Administrator and Interprofessional Education Project Coordinator in the Office of Interdisciplinary Programs within the Office of the Vice Provost for Academic Affairs and Faculty Development. Today, we will present to you an overview of the OUHSC Interprofessional Education Program Evaluation. But before we dive into our presentation details, I would like to introduce to you our IPE Program Evaluation team members. So in addition to me, our fabulous team members include Margaret Robinson, our Associate Director in the Office of Interdisciplinary Programs, Dr. Mary Gowin, an Associate Professor in the Department of Family and Preventive Medicine and the Director of Primary Care Health Policy Division, Kylie Pathoud, our IPE Simulation Manager, and Kat Tabak, our Graduate Research Assistant. And now, Kat will discuss our presentation agenda and program context.
Thank you, Dr. Sharif-Sandel. Our presentation will include a rundown of the OUHSC IPE Program Evaluation, which includes project context, overview, evaluation plan preparation, and a review of project goals. This project is an OUHSC IPE Program Evaluation project initiated in the Office of the Interdisciplinary Program, housed in the Office of the Vice Provost for Academic Affairs and Faculty Development, and in collaboration with the Interprofessional Educators and Practitioners Association. What is IPE? IPE is where learners from two or more professions learn about, from, and with each other. In our case, these learners come together from OUHSC's 7 medical colleges who we work closely with. As a team, we are tasked with developing, implementing, and operating a wide range of campus-wide IPE activities. This is an ongoing process as we evaluate each activity to determine and adapt to best practices that aid the students and faculty in gaining a deeper understanding of what IPE is. These activities include, but are not limited to, simulations, our Unity series, as well as clinical experiences. The evaluation of each IPE activity is based upon the implemented IPE curriculum and participant data collected from each activity. The data is reviewed and analyzed prior to being presented for review to the IPE Curriculum Committee, as well as campus stakeholders. Annually, over 3,000 students enroll in the 19 participating programs OUHSC has to offer. Out of these 3,000 students, over 1,000 students choose to take the step to become IPE learners by signing up for and participating in one or more of the 21 IPE curricular activities that are offered throughout the year. Through these activities, students get exposed to over 400 primary care patients and the opportunity to gain over almost 500 clinical hours annually. This is possible with the support and mentoring of our 200 plus faculty champions. On our team, not everyone does everything, but everyone does something. And now, here's Dr. Sharif-Sandel, who will provide the overview for the IPE program.
Thank you, Kat. So after years of content assessment and data reporting regarding curricular outcomes, our Office of Interdisciplinary Programs initiated an official process for comprehensive programmatic evaluation. Here we wanted to share some of our IPE program evaluation project goals. First, in order to assess curricular outcomes, foster curricular development, and provide baseline data for quality improvement projects, we need to continue to gather program metrics. So our Office of Interdisciplinary Program activity outcome metrics related to short, medium, and long-term strategic goals will be collected as well. We also want to work towards identifying any gaps in our current IPE program assessment and evaluation practices. And finally, we aim to report out on our IPE program evaluation to internal and external stakeholders. Our IPE program evaluation project consists of 4 main steps: IPE program assessment, developing a logic model, identifying a standardized assessment tool that can be used for all of our IPE curriculum, and develop a sustainable template for our IPE evaluation plan in effort to be implemented this upcoming fall of 2022. In the next slides, I will go over each of these steps in a little more detail. The first step in our IPE evaluation project started with the amazing work that Dr. Harnden and the IEPA Research Committee completed when they assessed OUHSC IPE status, our academic strategic plan, accreditation requirements, national best practices, and other OU evaluation plans. Next, they proceeded to create IPE program goals that were formalized in a logic model. This logic model is shown on your screen, and this provides a visual map showing the relationship among program activities, output, outcomes, and program impact. Step 3 in our IPE program evaluation project includes the identification of a sustainable assessment tool that we could use across all of our IPE curriculum. Example of previous tools considered is the Learner Pre- and Post-Competency Self-Assessment, or IPASS, IPE activity evaluation, evaluating learner attitudes, satisfaction, learner knowledge. Team research led to the identification of the Jefferson Team Observation Guide, or JTOG, as the recommended assessment tool. JTOG measures team attitudes and skills and is based on the 4 IPEC core competencies for interprofessional collaborative practice. It is composed of 16 questions per survey completed following all IPE activities, and is required to be completed by all of our participants, and it provides a baseline for data. Step 4 of our IPE program evaluation project included collaborating with both Drs. Harnden and Gowin to develop a sustainable template for our IPE evaluation plan, which is built from the logic model. We plan to present a draft of our IPE program evaluation plan at the IEPA All Committees Retreat Summer of 2022, where we will highlight defined IPE activities to be evaluated and manageable objectives and methods of internal and external reporting. In order to create a sustainable IPE evaluation plan, we need to prepare for data collection, processing, data analysis, and reporting. Our IPE program evaluation data collection process includes identifying IPE project data sets to be collected, collaborating with OUHSC IT and institutional research offices, as well as utilizing REDCap for the majority of our data collection, and ensuring all data is stored on secure servers in comprehensive databases. Our plan for data processing entails standardizing IPE project data sets, gathering student program data from OUHSC institutional research and OU Norman. Data we seek to process will include student college, degree and year in the program, and date of graduation. Through our current work, we were able to create a standardized data map that includes an overview of all of our IPE projects, project information, data of activities, data collection tools, and data description. For our IPE data process and analyzing part, we aim to utilize best practices for data analysis and are collaborating with campus resources to identify appropriate data analyzing software. In addition, we will use IRB-approved analysis protocols on JTOG-related data. One of our goals, like we mentioned earlier, is reporting data to colleges and their departments for accreditation purposes, on-demand scholarly work, preparing annual reports to campus constituents and stakeholders, including our IEPA Curriculum Committee, and last but not least, for IPE graduation transcript notations. Reaching our project goals won't be possible without the great efforts of our evaluation and assessment project team that work to clarify specific research purpose and questions related to any of our IPE programs, help determine the type of evaluation, whether it be quantitative or qualitative, and also participate in data collection, analysis, and reporting of results. The current annual timeline for our IPE program evaluation reporting is July 1st to June 30th, and our reporting structure will consist of process and impact evaluation, as well as program administration. For the purpose of continuous quality improvement and project or program success, we aim to identify gaps in our current IPE program assessment and evaluation practices. We have previously identified a gap in our program practices, which is the need for a comprehensive and consistent utilization of a standardized data collection tool, which will help us measure the impact related to IPEC competencies. We can only be successful with our evaluation plan if we share our findings with our constituents. These findings will be available for reporting through request and online, and we aim through reporting to participate in presentations locally and nationally. Some of the presentation conferences examples are Nexus Summit and collaborating with across borders, and also supporting our team and our collaborators in publications through our Office of Interdisciplinary Programs. Here, I'd like to provide you with the contact information of our interprofessional education evaluation team members if you have any questions to them regarding our IPE evaluation plan. Here, I'd like to thank you, all of our 7 colleges across campus, as well as our collaborators, the OUHSC IT office, our OUHSC Office of Institutional Research, Dr. Brant Whisker, Dr. Angela Harden, our IEPA Research Committee, and OSCTR and REDCap. With that, I'd like to thank you all for joining us today, and we'd like to welcome any questions. Thank you.